In 2020, I was in medical school, and I was the health officer for the Standing Committee on Health and Environment for the Federation of African Medical Students Association. That's FAMSA, for the University of Ibadan Medical Students Association. And usually we would celebrate World Health Days, different health days, and then do like a project to just commemorate the day and ensure that we give health information and promote public health and good hygiene practices for our communities. And we were preparing for the World Blood Donor Day, and then I just went to check that, okay, just know what has been done around blood donation, because we didn't just want to do like a one-time event and that's it. And that was when I realized that the mortality statistics from unavailability of blood in blood banks in hospitals was quite high. I mean, sickle cell patients, women with postpartum hemorrhage, victims of road traffic accidents, and the likes of them. And then we were like, okay, how do we meet these demands? So there was a very critical gap. Nigeria needs over 1.8 million blood units every year to be able to meet her critical care patient demand for blood. But then from the National Blood Service Commission data records, we were just hitting an average, little above the 500,000 average. And we were like, okay, how do we do this? And that's how we decided to mobilize medical students and young people in Ibadan. And we're like, let's start a community. We called it the 70-man blood donor club, where we would get 70 people to just commit to donating blood at University College Hospital in Ibadan every 3 to 4 months, so that in our community, as it were, we would always have constant blood supply in the blood banks, and so that when people come to UCH, they have blood when they need it and as the time that they need it. And then there was a situation of a sickle cell patient who came in. She needed blood. She was pregnant, and then she needed blood because of she had risk of having a postpartum bleeding from the pregnancy, and it was very critical. They were like, who do we? She didn't have a family member in Ibadan, nobody to run to, and then they reached out to us, and it was very striking because, I mean, if we were not existing, if we were not doing something like that at the beginning, what it means is that woman would probably have died in the course of giving birth to her first child, and which is not supposed to be. I mean, in developed countries, there are ways that they sort this out, and that was really what inspired us to, transform this from just the 70-man blood donor club to becoming the blood drive network, where we would have a network of young people across, not just Nigeria, across Africa, who would see regular voluntary blood donation as a corporate social responsibility and commit to it, not only for saving lives, but also for their own health benefits, because blood donation is like a double-edged sword.
TBDN started as a movement in the year 2020, the outbreak of the COVID-19 virus. And Nigeria has a blood need of over 1.7 million pints per year, and we are able to only provide, I think, 500,000 yearly, which is, more than 50% shortfall. And COVID-19, made it even more glaring because voluntary blood donors were scared of going to the hospitals for voluntary blood donation exercises, largely because of the fear of contracting the COVID-19 virus. And that was when TBDN was born. We had to come into the scene and begin to start a behavioral change awareness to enlighten people that there are measures that can be taken to protect yourself from contracting the COVID-19 virus, while simultaneously volunteering as a voluntary blood donor to give blood to patients in need. Now, the COVID-19 virus did not stop the need for blood. It did not reduce the quota that is needed every year. But one of the things that it did was it affected the little number of people that were going for voluntary blood donation exercise at the time. And that was why TBDN was founded, to be able to meet that need at that point in time. So even during the COVID-19 pandemic period, we even had blood drives. We had, student communities come together for voluntary blood donation exercises while adhering to social distances and, preventive measures to avoid contracting the COVID-19 virus. And, that was the beginning of the story of the Blood Drive Network.
Initially starting, it was getting to convince people, because in this part of the world there are a lot of misconceptions, myths. So some people believe that, if they donate blood, their blood will be used for, some voodoo activities, witchcraft and all of that. Some people also believe that if they donate blood, their libido would reduce, sex drive would reduce. Some people also believe that, if they donate blood, that which blood do they have in their body? So a major problem was convincing people to see blood donation as something that is not just beneficial for somebody else who needs the blood, but also beneficial for them in terms of reduction in cardiovascular heart problem, cardiovascular risk, cancer, reduction in the risk of blood cancers, because the marrows have increased cell turnover when you donate blood regularly. And that was a major issue. And then also the fact that some of them needed consent from their parents to be able to, even though they were legal adults, as it were, because we are for TBDN we only work with legal adults, so that's from 18 years and above. But some of them, again, because of fear and of the unknown and all of that, they needed consent from their parents. They've not done it before. They needed consent from their parents. I remember when we went to Leeds City University, it was a major issue. So the management was like, that they needed the consent of the parents for the students to be able to donate blood voluntarily. So those were major issues. And then another issue was funding, because of course, as much as you want people to do stuff voluntarily, they're also looking at, what do I get back in return? So, and because we are advocating for non-remunerated voluntary blood donation, we were like, how else do we encourage people? So how about doing souvenirs? How about we provide food? How about we provide refreshments, drinks? We provide something that they can always take back. So maybe a shirt like this, or a biro, or a book that they just take back, and they can always remember that, I donated blood on so and so day, and I was able to save somebody's life. So funding was a major issue as well. And then community entry. So the way we work, we don't just work in just Ibadan. So we are trying to go to other, because we are niched with universities and tertiary institutions, as it were, because that's where we have youth population, and that's where we can get, young people who would drive social action in terms of voluntary blood donation as a corporate social responsibility, and drive social change in terms of change for the communities of people, critical care patients who need blood, and even their relatives who are sourcing for donors for their loved ones. So sometimes getting to access some of these schools has been difficult. There's a particular school that we've been trying to reach for years now, and we've not been able to get entry, again because some people feel that voluntary blood donation has issues around it, and it's not something that you should bring to a public institution and things like that. So that's been a challenge. Getting relevant stakeholders also to see the importance of promoting this. So we've been trying to do some sort of policy advocacy as well, to get our government to promote voluntary blood donation amongst young people, especially in tertiary institutions, maybe through grade points in schools and all of that. So reaching relevant stakeholders and getting them to see the importance of promoting this and raising so much support for voluntary blood donation has also been some sort of issue. And the fact that for some people, voluntary donation is just a one-time thing, maybe on World Blood Donors Day, and that's the end. But for us at TBDN, we see it as something that should be done constantly. So every 3 to 4 months, you should donate blood, as long as you're fit, you're healthy, and you are eligible.
Challenges while organizing blood drives, quite much. First we have to begin to debunk the myths around voluntary blood donation. I've had a time where someone asked me that, he heard that his sexual libido is going to be reduced when he goes to donate blood, and does not want that to happen. A lot of people believe, they believe a lot of superstitious beliefs surrounding blood, and given the context of the environment that we are in, it's quite understandable. So our work largely is beyond just organizing drives. We have the behavioral change aspect that I spoke about earlier, where we begin to talk to young people, advocate for voluntary blood donation and the importance of voluntary blood donation, the health benefits, and so much more. So one of the things that we do is we try to make them, we ensure that our donors see a need to want to donate blood, and also debunk the myths surrounding voluntary blood donation that impedes people from coming out to voluntarily donate blood. Other times is the distance barrier. People, it's quite far for people, to come down to donate blood. Sometimes for some people, it's that in the locality that they are, there are no blood banks readily available to them. And also sometimes people are asking for money, to donate blood, and then we have to begin to explain to them that it's a free exercise and they have to do it for free. At that point, some of them make a U-turn. They are not, they are no longer interested. Others, proceed. Sometimes it's because they complain that even after donating blood, they hear that those who need the blood still have to pay for it at the blood bank where they need it and all of that. And they'll begin to explain to them that all of the tests that are being, done for voluntary blood donors, the samples taken, all of the tests that are done for the preservation of the blood as well, comes at a cost. But the voluntary blood donor is not going to be the one to bear that cost. It's those who are going to be using the blood that are going to be bearing the cost. So these are some of the challenges. Other times is you organizing the blood drive and then you have a lot of people coming, say for instance, 50 people coming, and then you've send SMSs, put calls through, send emails and all of that to confirm. And then on the day of the blood drive, about half of that number are not available. You call them, the numbers are switched off, and then you now begin to look at what are the things that we can do, and then you now begin to look at our contingency plans or reaching out to our already established donor community to see those who are are eligible to donate blood and are fit and available at the time to donate blood. So these are just some of the challenges that we face at the blood drive meetup.
The body that has a legal authority in Nigeria and approved by the World Health Organization, the WHO, is the National Blood Service Agency. So every time we have to do a blood drive, especially outdoors meaning outside of a accredited hospital facility, so either a government hospital or any facility that's been accredited for blood donation processes, we have to engage the National Blood Service Agency. So we don't collect blood without them. And that is because they have the resources to take this blood through the necessary testing. They have the equipment to take it through the necessary test, ensure that it is safe. Because as much as we want people to donate blood, we want the patients that are receiving it to get it safely. So it's not just about getting blood. We also want to ensure safe transfusion, because that's the hallmark of the blood donation supply and delivery process, that transfusion is done safely and then for the benefit of both donor and patient, and nobody is put at risk. So we engage the National Blood Service Agency because they have the resources to ensure that. So when they come around, we do all of the testings to check that and ensure that the donor is eligible, especially the PCV check, and then other transfusion transmissible infections like syphilis, HIV, hepatitis, and the likes of them. So they do that, and then once the blood is certified fit, they store it. So they have a large blood bank. So again, why I mentioned this is because in a hospital facility that's accredited, like I said, there's a blood bank. So if we are doing a drive and we are bringing people to the hospital facility, we are assured that there's a storage where the blood is stored and kept for as long as possible until patients need it and can access it. But when we are doing an outdoor drive, we need to be able to transport the blood that's collected in the blood bank to a center where it is stored and kept. And so we work with the National Blood Service Agency, and they do that. So they process it and then keep it there, and then patients can always access it, and even hospitals can always go there to get blood for their patients when they need it. So that's how we ensure that it is efficiently utilized, it is kept safe, it is stored in the proper way, and at the end of the day, when the patient needs it, they can access it anytime, because the blood bank runs 24/7.
Okay, hi, I am Obera Chema. I'm a volunteer at TBDN. I'm here today to donate blood. I have donated blood, and the experience so far was nice. It was not too bad.
My name is Ali Ibrahim. and I am a member of the Maternal Health and Child Nutrition in collaboration with the Blood Drive Network. So I'm also a volunteer. I donated blood today, and my experience so far, well, I think that's always been normal for me. I don't always feel any form of pain or dizziness, but I'm happy to have contributed to donating blood today. Thanks so much.
Hello everyone, my name is Adiola. I came to donate blood at the Blood Drive Network. It has been an awesome experience, exhilarating, and I would love to do this another time next time. Thank you very much.
Hello, my name is Daniela Wikile. I'm here with the Blood Drive Network to donate blood for children of Principal HP Foundation for Children's Day, Sickle Cell Champions. It's a lovely experience. I volunteer with the Blood Drive Network as the project manager.
For our organizational team, of course, there's a powerhouse that powers all that we do. It's not just myself, but if it was myself, I probably would have broken down by now. So there's a powerhouse, and that's our organizational team. So essentially, we do a co-creation in the organizational team where we put out a call for volunteers to work in different arms or different teams. So we have our design team, visuals and media team. We have our research team. We have our internal relations. They take care of the donor community, and then ensuring that donors are regularly reminded to go and donate. We also have the content team. We have a couple of other teams. We have our strategy and growth team. We have our programs and projects execution team, and we just have a couple of people. So we put out that co-creation call, more like a crowdsourcing for talent, and then we get people to apply, and then we take them through 3 interview phases. So the application phase, and then those who scale on to the next phase get to go through the interview. That's like the oral phase, part of the recruitment process, where we try to ascertain their skills in terms of communication, and then are able to determine their commitment to TBDN and what we do, and their readiness to serve in the team. And then from then we move on to the probation phase. So the probation phase is where they've scaled through the interview, and now they're trying to ascertain if they're able to perform the task that they say that they can. We're trying to see them utilize their skill set to contribute to what we're doing at TBDN essentially.
We have a lot of volunteers that have been with us since 2020, 2021. It's been an awesome experience. We've had volunteers who have left the country for studies, in the United States, where we were, privileged and happy to also write them recommendation letters for the work that they've done with us at the Blood Drive Network. Our volunteers are nothing short of amazing. They are excellent people. The work that we do is a thankless job, really. There's nothing anybody can give you for coming to donate your blood that will be worth the blood that you donated. So this is a big shout out to all of our volunteers. Thank you. We love you. We celebrate you. Thank you for donating our blood to save lives. Our volunteers are amazing. Different people from different backgrounds with different expertise, all coming together to achieve a common goal of ensuring that nobody dies because there is a lack of blood when they need blood. And that's one of that's our core area that we work in. So thank you to our volunteers. Also, it's not been easy working with diverse people with diverse backgrounds, but it's a learning curve. We learn every day. Of course, and that's one of the things that we do. We also organize trainings, soft skills training, emotional intelligence, communication, teamwork, accountability, just to ensure that there's cohesion, there's synergy within the volunteers of the Blood Drive Network. And so far, so good. It is evident in the results that we get.
For our future plans or goals, we are looking to automate our processes. So currently it's a bit manual, if I would use the word. So we are looking to automate our processes, essentially make it easier for donors to be able to register with us and then become regular donors affiliated with TBDN, so that anywhere we get emergency requests, we can always, we have like a pool of donors to draw from, as it were, to respond to those requests. So we try to automate our processes and also automate the process of getting blood to remote or last mile population, because it's easier to get blood around urban or suburban areas, but for those who are in the rural areas who do not have access to health facilities and all of that, is a bit much tedious and difficult. So we're also trying to see how to make it easier to get blood to them as at when they need it. We are also looking, I mentioned policy advocacy, so having policies that will promote voluntary blood donation in our tertiary institutions. So using like maybe a grade point attached to community service, that is voluntary blood donation. So you have like a grade point that comes with you being a regular donor, and then that also even being a leverage you can use to assess certain opportunities in Nigeria once you come with your donor card and there's a proof of your record of voluntary blood donation. We are also hoping to be able to work with the National Blood Service Agency to be able to have a digital product that would enable seamless connection of donors and recipients at the time of need, and for blood drives to be organized anywhere by young people without necessarily having to wait for the national wait for a big event. Also, with regard to our future goals, we are looking to explore partnerships across Africa, because we don't just want this within Nigeria alone. We want African youth to see voluntary blood donation as something that they should be committed to as part of their social engagement for community good. So we're looking forward to partnerships. Currently, we have partnerships in Tanzania. We are currently also working on partnerships with related CSR initiatives in Kenya. So we are looking forward to having lots more partnerships so that we would be able to collaborate better and synergize efforts in ensuring that regular voluntary blood donation is a social action that African youths engage in to ensure a healthy community. One word, one message: just go and donate blood. I mean, it's refreshing. There's a way it just helps your mental space when you know that you're doing something for somebody that you may not know anywhere. And I remember watching a video clip, and then the person had donated blood and did not know that the blood was going to his distant cousin somewhere who needed that blood type, and it was a rare blood type. So just do it. Just go ahead and do it. And if you need help, you need support, you have questions, you can always reach us at the Blood Drive Network on Instagram, Twitter, LinkedIn, email, and even on YouTube and Facebook.
TBDN, the Blood Drive Network.
My name is Mrs. Ewonode Margaret. I'm grandma to Jumai Adebisi Jumai, that is a champion. We came here to see those people that donated blood for the champions at Crisbo Hospital. And we are one of the patients there that attended clinic there every second Saturday of the month, that they used to treat them. They used to give them drugs. So we appreciate those people that came to donate blood for those that for the Crisbo champions. We appreciate them. We pray that God will continue to assist them, take them to higher heights in life in Jesus' name.
Чрезвычайной ситуации.
Награждается победитель, проект The Blue Drive Network Foundation на сцене Чиндима Окора, Нигерия.
Африка давно находится в острой нехватке донорской крови, но активисты из Нигерии нашли решение этой проблемы. В рамках проекта более 3000 молодых людей стали донорами и продолжают постоянно сдавать кровь. Теперь тысячам пациентов почти сразу же доступно переливание, а к 2030 году в 40% случаев потери крови жизни людей будут сохранены.
Вам слово.
Hi everybody. Добрый вечер всем.
Volunteers are not necessarily people who have all the time in the world, but they are people who have the heart to do good, help people and change the world one person at a